I want to tell you about a woman named Margaret, 73 years old, retired school teacher, 34 years in the classroom. She was the kind of person who brought homemade soup to sick neighbors, who walked her dog every morning without fail, who took her medications on time and never missed a checkup. Margaret was not doing anything wrong. She was doing everything she had been told to do. But for 3 years, quietly, invisibly, without a single dramatic symptom, her heart was getting weaker. Her ejection fraction, that is the measure of how much blood the heart pumps out with each beat, had dropped from 62% to 44%. A healthy heart pumps above 55. Margaret's was failing, slowly, silently. And when she finally sat across from me, after two other physicians had told her she was simply getting older, I asked her to walk me through an ordinary day. Just an ordinary day. What she ate, what she drank, how she slept, how she sat, what sounds filled her house, what she worried about. Within 20 minutes, I had identified 5 things. 5 completely ordinary, completely unremarkable parts of Margaret's daily life that were, together, pulling her heart apart from the inside. None of them were dramatic. None of them made headlines. Not one of them had ever been mentioned in any of her previous appointments. Here is the thing about heart failure after 60 that nobody explains clearly enough. It is almost never one catastrophic event that weakens the heart. It is a slow accumulation, a daily erosion. 5 small things, done consistently, that compound over months and years into something serious. Stay with me, because what I'm about to share changed how I think about the quiet daily habits that weaken the heart. And it might change everything for you too. I'm Dr. Soren. I'm a cardiothoracic surgeon with 28 years in the operating room. I have performed over 2,500 open heart surgeries, and I can tell you with absolute certainty, the hearts I operate on did not arrive in crisis overnight. They arrived after years of small, compounding stresses that nobody caught in time. I make these videos because the conversation I'm about to have with you is the one I wish I could have with every patient before they reach my operating table. Most doctors don't have time to examine the ordinary details of a person's day. I am going to examine yours right now. Here is the critical thing to understand about your heart after 60. It is working in a fundamentally different environment than it was 20 years ago. Your arteries are stiffer. Your heart muscle itself, the myocardium, has less elasticity. It fills with blood slightly more slowly and empties with slightly less force. These are normal changes, but they mean one thing with absolute clarity. Your heart has less reserve, less margin for error. Think of it like a rubber band that has been stretched every day for 60 years. It still works. It still snaps back, but it no longer has the same tolerance for additional strain. The same pull that barely registered at 40 now brings it measurably closer to its limit. Studies show that adults over 65, who carry even 2 or 3 of the daily risk factors we are about to discuss, have a 64% higher rate of developing heart failure within 10 years compared to those who carry none. 64%. That is not a small statistical footnote. That is the difference between a functioning heart and an operating table. Advice designed for a 45-year-old assumes cardiovascular reserve. After 60, that reserve is narrower. Every daily input matters more. Every stressor lands harder. That distinction, and what to do about it, is exactly what we're covering today. Number 1, sitting for more than 8 hours a day, even if you exercise. Here's what surprises most of my patients when I say this. They tell me they walk every morning. They do their 20 or 30 minutes. They feel they have done their part. And I have to explain, gently, carefully, that exercise and prolonged sitting are 2 separate physiological variables. One does not cancel out the other. What happens inside your body when you sit for extended, unbroken periods is called venous stasis. That means blood flow in your lower body slows dramatically, pools in your legs and pelvis, and returns to the heart in sluggish, uneven surges rather than the steady, rhythmic flow the heart expects. Your heart has to work harder to pull that sluggish blood back. The muscle thickens over time from that added effort. And a thickened, stiff heart muscle, what we call diastolic dysfunction, is one of the most common and underdiagnosed causes of heart failure in adults over 65. I have seen this with my own eyes on the operating table. Hearts that were not blocked. Hearts with clean arteries. Hearts that had simply been overworked by the mechanics of a sedentary daily life for too many years. A study published in Circulation found that adults over 65 who sat for more than 8 unbroken hours per day had a 46% higher risk of heart failure hospitalization compared to those who interrupted their sitting every 45 to 60 minutes, regardless of whether both groups exercised regularly. The fix is precise. Set a timer on your phone, on a watch, on a kitchen clock for every 45 minutes while you are awake and seated. When it goes off, stand up, walk to the kitchen, walk to the window. Do 10 slow calf raises holding the back of a chair. You do not need to exercise. You need to interrupt the stasis. 45 minutes. Stand. 2 minutes of movement. Sit again. That pattern, maintained throughout the day, changes the mechanical load on your heart in a way that a single morning walk cannot replicate. Number 2. Chronic loneliness and social isolation. Let me ask you something, and I want you to answer it honestly, even if it is just to yourself. When did you last have a real conversation? Not a transaction, not the pharmacist or the checkout line. A real conversation. Someone who knows your name. Someone who asked how you actually are and waited for the real answer. I know this is not what you expected in a video about heart health, but here is what the brochure doesn't show you. Loneliness is not an emotional inconvenience after 60. It is a direct cardiovascular stressor with measurable physiological consequences. When you are chronically isolated, your body maintains elevated levels of cortisol, your stress hormone, throughout the day and night. Persistently elevated cortisol drives systemic inflammation, that slow fire burning inside your blood vessels and heart muscle continuously. It raises blood pressure. It disrupts sleep architecture. It accelerates arterial stiffening. The heart, operating in a body bathed in stress hormones, is working in a chemically hostile environment every single hour. Earlier in my career, I treated the heart as a mechanical organ. I focused on blockages, rhythm, and pressure. I did not ask about loneliness. I did not think it was my department. I was wrong, and the research that has accumulated in the last 15 years has made that unmistakably clear. A study published in the journal Heart found that adults over 65 who reported chronic social isolation had a 29% higher risk of heart attack and a 32% higher risk of stroke compared to those with regular meaningful social contact. Numbers comparable to the risk associated with smoking 15 cigarettes a day. The fix: schedule, and I mean literally put it in your calendar. 3 meaningful social interactions per week. Not digital, not texting. A phone call with a real voice. A coffee with a neighbor. A weekly commitment at a library, a community center, a place of worship, a walking group. 30 minutes of genuine human connection 3 times a week measurably reduces cortisol levels. Your heart does not just want this. After 60, it needs it. Have you noticed yourself becoming more isolated over the last few years and wondered what it might be doing to your health? Write it in the comments. I read every single one. Number 3, unmanaged sleep apnea, especially the kind you do not know you have. Here's what nobody tells you about sleep and the heart after 60. You may be stopping breathing in the night, repeatedly, dozens of times per hour, and you may have absolutely no idea. Sleep apnea, that means a condition where the airway repeatedly collapses during sleep, causing brief interruptions in breathing, is not just a snoring problem. It is a cardiovascular emergency happening in slow motion, night after night, for months or years. Every time breathing stops, oxygen levels in your blood fall. Your brain triggers an emergency stress response. Cortisol spikes, blood pressure surges. Your heart is yanked out of its recovery rhythm dozens of times each night, every single night. Think of it this way. Imagine you are trying to repair a road, and every 40 minutes someone drives a truck through the construction zone. The repair never completes. That is what unmanaged sleep apnea does to your heart's nightly recovery process. Studies show that adults over 65 with untreated moderate to severe sleep apnea have a 58% higher rate of atrial fibrillation, an irregular and dangerous heart rhythm, and a 2.6 times higher risk of developing heart failure within 5 years compared to those without the condition. The fix begins with a single question you can answer right now. Do you wake feeling genuinely unrefreshed, regardless of how many hours you slept? Do you have a bed partner who has ever mentioned that you stop breathing, gasp, or snore heavily? Do you experience excessive daytime sleepiness even after a full night? If 2 or more of those apply to you, ask your physician about a home sleep study, a simple test done in your own bed with a small device you wear on your wrist and finger overnight. It is not invasive, it is not expensive, and the information it provides could be the most important cardiac data your physician has ever received about you. Number 4, excess dietary sodium, hidden in foods you would never suspect. Here's what the standard advice gets completely wrong about salt after 60. Most people hear reduce sodium and they put the salt shaker away. They stop adding salt at the table. They feel they have addressed it. What a 7-minute appointment almost never covers is that the salt shaker contributes approximately 11% of the average person's daily sodium intake. 11. The other 89% comes from processed foods, and not the obvious ones. Bread, breakfast cereals, canned soups, deli meats, cottage cheese, salad dressings, even some sparkling waters. Sodium is in places that taste nothing like salt. What excess sodium does to an aging heart is direct and mechanical. It causes fluid retention. Your body holds water to dilute the sodium concentration in your blood. That extra fluid increases blood volume. Increased blood volume means increased pressure on arterial walls. And increased arterial pressure means your heart must work harder with every single beat to push blood through a system under elevated load. After 60, with already stiffened arteries and reduced cardiac reserve, that added load compounds quickly. It is the equivalent of asking a tired engine to pull a heavier trailer every day without any additional fuel. What would I recommend for my own parent? I would tell them, stop counting what you add and start reading what is already there. A study published in the New England Journal of Medicine found that adults over 65 who reduced dietary sodium by 1,000 milligrams per day without any other lifestyle change had systolic blood pressure reductions averaging 6 to 8 points within 4 weeks. That is comparable to adding a blood pressure medication. The fix: for the next 7 days, check the sodium content of every packaged food you eat before you eat it. Your daily target after 60 should be no more than 1,500 milligrams total. Most adults over 65 are consuming 3,400 milligrams or more without realizing it. Read the label, add the numbers. The awareness alone will change your choices. Number 5, untreated chronic stress, especially the low-grade, constant kind. Here's what surprises most of my patients when I explain this one. They say, I'm not stressed. Nothing dramatic is happening. Life is quiet. And I explain, the most damaging kind of stress after 60 is not the acute kind. It is not the crisis or the emergency. It is the low-grade, persistent background hum of worry that has become so familiar you have stopped noticing it. Financial concern, health anxiety, grief that was never fully processed, the daily news. The slow accumulation of small worries that never fully resolve. This kind of stress produces something called chronic sympathetic activation. That means your nervous system's stress response never fully switches off. Your body stays in a mild but continuous state of alertness. Blood pressure remains slightly elevated around the clock. Inflammatory markers stay elevated. Your heart never fully enters the recovery state that it desperately needs, especially at night. I think of it like a furnace that runs 1 degree too hot all day, every day. Individually, each degree is nothing. Accumulated over years, the wear is profound. A study published in the Journal of the American College of Cardiology, following over 118,000 adults with a mean age of 67, found that those with clinically measured high chronic stress scores had a 40% higher rate of major cardiac events over an 8-year follow-up period compared to those with low stress scores. The fix is specific and measurable. Each evening, not occasionally, every evening, spend 10 minutes in what is called a physiological sigh. Breathe in through your nose fully. Then take a second shorter inhale to fully expand your lungs. Then exhale slowly through your mouth for 6 to 8 seconds. Repeat for 10 minutes. This specific breathing pattern is the only known technique that directly and immediately activates your parasympathetic nervous system, your body's off switch for the stress response. It measurably reduces cortisol within 4 minutes. It is free. It requires nothing. And it is one of the most powerful things you can do for your heart that is almost never discussed in a standard appointment. Let me come back to Margaret. When I finished walking through her ordinary day, all 40 minutes of that conversation, I placed my pen down and told her something that no other physician had said to her in 3 years. Margaret, your heart is not failing because of one thing. It is failing because of 5 small things that nobody has ever asked you about. She sat quietly for a moment. Then she said, "What do I do?" She sat for 9 hours every day, reading, watching television, doing crossword puzzles, rarely moving between 9 a.m. and 5 p.m. She had been isolated since her husband passed 4 years earlier, sometimes going 4 or 5 days without a real conversation. She snored heavily and woke exhausted every morning. Her diet was careful in terms of fat and sugar, but she ate canned soup most evenings, sometimes 900 milligrams of sodium in a single bowl. And she carried a quiet, unprocessed grief that she described as just part of life now, a low hum of sadness she had normalized completely. Not one of those 5 things would have triggered a single alarm in a standard clinical visit. Together, they were quietly dismantling a heart that had worked faithfully for 73 years. We addressed each one systematically, a movement timer set every 45 minutes, a weekly commitment at her local community garden that gave her 3 social contacts per week, a home sleep study that confirmed moderate sleep apnea, now managed with a simple device, a 7-day sodium audit that cut her daily intake by nearly 1,200 milligrams, and 10 minutes of breathing exercises every evening before bed. 14 weeks later, Margaret's ejection fraction had improved from 44% to 53%. She was taken off one of her 3 heart medications. And the morning I received her follow-up report, I also received a photograph in the mail. Margaret, standing in that community garden, holding a tomato the size of her fist, smiling in a way that, from everything her chart told me, she had not smiled in 4 years. On the back of the photograph, she had written 4 words: "The ordinary things matter." They do, Margaret. They do. Let me bring this together for you clearly and simply. 1. Break up your sitting every 45 minutes with 2 minutes of movement, not exercise, just interruption. 2. Schedule 3 real human connections per week, voiced, in person, meaningful, and put them in your calendar like a medical appointment. 3. Ask yourself honestly whether you wake refreshed, and if the answer is no, pursue a home sleep study before another month passes. 4. Read every sodium label for the next 7 days and aim to stay under 1,500 milligrams daily, without touching the salt shaker once. 5. Practice the physiological sigh for 10 minutes every evening. Full inhale, second shorter inhale, long slow exhale before you go to sleep. Start tonight with number 5. Lie in bed, breathe in fully. Take that second breath, then exhale slowly for 8 seconds. Do it 10 times. It takes less than 5 minutes. And your nervous system and your heart will feel the difference before you fall asleep. Your body has been working for you every single minute of your life. Give it what it needs. It will respond. If this video gave you something real, share it with someone you love. A spouse, a sibling, a friend over 60 who is living an ordinary day right now, not knowing what 5 quiet things might be doing to their heart. That one share might be the most important thing you do today. And tell me in the comments, which of these 5 hit closest to home for you? Was it the sitting, the isolation, the sodium hiding in places you never expected? I genuinely want to know. Everything I've shared today is general medical information based on published research and my clinical experience as a cardiothoracic surgeon. It is not a replacement for your personal medical care. Every person's situation is unique. Before making any changes, especially to medications or supplements, please have a full, honest conversation with your own doctor. That conversation, informed and unhurried, is exactly where good medicine begins.